This is Arilma St.Clair for the Physical Assessment class, Section D2 for Dr. Kopac. This is video number 1. Um, Hi, my name is Ari St.Clair. I'm a registered nurse and I'll be your nursing student today. What's your name?
Vilma Hardesty.
Very nice to meet you, Miss Hardesty.
Mm-hmm.
Okay, I'm going to conduct a physical assessment on you, and as I go through every part of or every system, I'm going to explain everything as I go. All right? So we're going to begin now. Allow me to wash my hands. So we may begin. For the purpose of this, I'm using a hand sanitizer to represent the washing of hands activity. The first thing I want to do is inspect your skin overall to make sure that there's no any type of lesions or nevi or any type of scars or any type of masses or any tattoos or piercing on your body. I also want to look at the skin color and also the texture. So one of the things I'm going to do is just put my hands on you to feel the temperature of your skin. Okay, and it feels nice and warm. Okay, and it feels moist. It doesn't feel dry. Okay, but it's clean and dry. And then I'm going to also look and inspect at the nails, and I'm looking for growth, for color. I'm also looking for for the shape that is nice and even, and also inspecting that has brisk capillary refill, less than 3 seconds, and you do indeed. Very well. Can I just do your toes and just look? Very good. Okay. And also look at the front of your neck. Look at your back. And as I inspect for the skin, I also look for any clubbing of the nails to make sure you don't have any type of impairment on your circulation. Now I'm gonna proceed with inspecting the face, the head symmetry, and it's nice and even. To look for any masses, any facial dropping of your eyelids, or any normalities like Bell's palsy or anything like that. And I'm going to also try to look at your scalp. So I want you to look down for me so I can look at your scalp. And I'm looking again for any abnormalities. And I'm going to proceed to palpate to make sure that there's no bumps. Okay. I'm going to also try to feel for your arteries that are in the temporal area right next to opposite sides of the eyes. Okay. To make sure that there's no thrills or irregular rhythms, and that they have a strong pulsation, and they're nice and even. I'm going to also proceed to feel your cardiac pulse on the right side. So I want you to look to the left. There you go. Okay, now I want you to look to the right. Okay, and it's nice and even and strong, palpable. Now, as I proceed with this examination, I'm also going to look at your eyes. And for your eyes, I'm going to turn off the lights, that way I'm able to see, reactivity to the light. But actually, let me do one more thing. I just want to look at the sclera. So I'm going to lift your eyelid. Can you look down for me? And I'm looking at the sclera, the conjunctiva. Look up for me again. Also looking at the sclera, conjunctiva. Make sure that there's no irritation, swelling, or any hemorrhage, any sign of that. I'm going to turn off the light now. Actually, I need to check the lacrimal duct to make sure that there's no obstruction or air buildup. That could be an indication of congestion. And I'm going to use my pen light to see the reactivity of the light on your eyes. I want you to keep on looking at me, okay? And I'm going to assess one eye at a time for brisk, reaction to the light, and that's nice and brisk. Very good. And that is the 3 centimeters. And breast reactive. I'm also going to do something called consensual. See how the reaction on one eye actually allows the other eye to also behave similarly. It's called consensual. Very good. Excellent. Now I'm going to proceed to use the flashlight as if it was a ophthalmoscope for the purpose of checking the fundoscopy part of the exam. So I'm going to actually use my right eye on your right eye, and as I bring it closer to you, I'm going to ask you to look straight at me, like through me. So look at me. There you go. And as I bring it close to you, one of the things I'm going to be looking for is the red reflex, the retina vessels, the optic disc, and macula. I'm also looking for any papilla edema, any hemorrhage, or any type of exudates. I'm going to repeat the activity again, once again, and look for the same landmarks on the left eye. Now, after this, I'm going to proceed to inspect the ears for symmetry. And one of the things I'm looking for are basically, the external earlobes, the tragus, the pinea, the rest of the earlobes, the auricle, and also I'm going to look into the ear canal. Could you look to the left for me, please? Thank you. And as I look, I'm going to pretend this is the otoscope, the flashlight. And as I look, I'm going to use the speculite that is with the largest diameter that can be tolerated by the patient. It's nice and comfortable. And I'm going to look, and as I inspect the ears, one of the things I'm going to be looking for is the color of the ear canal and also the grayish color of the tympanic membrane. And I'm looking for mobility and light reflex, along with the short process of the malleus and the handle of the malleus, and for the conal light. I'm going to ask you to turn all the way to the left, and I'm going to repeat again. And I gently pull up and back the ear so I may place the specula inside with the of the otoscope. And again, I'm going to be looking for the ear canal, the color, mobility of the membrane, of the tympanic membrane. And I'm going to also look for light reflex, and look for the landmarks that are the handle of the malleus, the short process of the malleus, and the conal light. As I proceed, I'm going to look at your nose. So in the nose, I'm looking for symmetry, and I'm looking for the appearance of the nose, make sure there's no deviation of any drainage. And also, I'm going to ask you to do a little bit of a test, which is called the nasal patency test. And I want you to use the right index finger. There you go. And I want you to inhale. Take a deep breath. Very good. I want you to repeat the patency test on the left side, just to make sure that there's no obstruction when you are trying to breathe, etc. So I'm going to use my flashlight to represent once again the otoscope, and I'm looking into the right eye. So I want you to tilt your head back a little bit so I can look in there. And as I look inside of the nose of the right sinus cavity, I'm going to be looking for the septum, the turbinates, the nasal mucosa, and I'm looking for any abnormalities like hemorrhage or any polyps. And I'm going to repeat the operation on the left side. And again, I'm looking for my septum, my turbinates, and the nasal mucosa, and for any signs of polyps. Now, one thing that I'm going to do is I'm going to put a little pressure on your sinus. This is called the maxillary, and I want you to tell me if that feels tender or hurts.
No.
Okay. And I'm going to also do the frontal sinuses. Does that hurt when I press?
No.
Okay. Very good. Now, that concludes the nose, so we're going to move on with the mouth. So as I go through the mouth, I'm looking at the lips to see that they are nice and moist, and they got good color, and that there's no evidence of abnormality, so facial dropping. And I want you to open your mouth for me. And I'm looking for dentation, the color of your gums, looking at your tongue, the aspect of your tongue. Can you stick out your tongue for me? Very good. Can you, with the tip of your tongue, touch the roof of your mouth? I'm looking for the frenulum to see symmetry and circulation. And also, I'm going to use a tongue depressor to look at the buccal cavity. So, can you open your mouth real big for me? There you go. And I'm looking for the skin color or any ulcerations, looking at the gums, see if you're missing any teeth, and how's your gum in terms of status of risk of gingivitis. I'm looking for the opposite side as well, and looking at those teeth and in between them. I'm also looking at the roof of the hard palate, and I want you to stick out your tongue for me. I'm going to put the tongue depressor, and I want you to say ah for me. Ah. Very good, because I'm looking for the uvula, the tonsillar fossa, the soft palate, and I'm also looking for the pharynx to make sure there's no obstruction, no swelling, no redness, no evidence of bacterial plaque, and make sure that it's nice and healthy and it looks really nice and moist and pink. Okay. Now I'm going to proceed to do the neck, and one of the things I do is try to look anteriorly the neck and make sure that the trachea is in position and not deviated. You stick your neck out. Very good. And posteriorly, I'm going to palpate the thyroid. So I want you to turn a little bit so I can go ahead and palpate. Just look up for me. And I want you to take and swallow for me. Okay. Again. Okay, very good, very good. Now, with the neck, I also need to look at your trigeminal mandibular jaw and that joint to see if there's any popping or anything. So I want you to open and close for me. Very good. Does that hurt? Feel tender at all? No. Okay, open again. Very good. Now, the other thing I actually want to feel for is your nodules, and those are the little lymph nodes, and these are the pre-auricular, post-auricular, and then tonsillar, and then we submandibular, and then the submental. The other thing I'm looking for is the occipital, which is the back of your neck, or the back of the lower part of your head too. And I'm actually looking for both the superficial and deep cervical lymph nodes. And then I want you to shrug your shoulders. I'm going to actually look for the deep cervical. Excuse me. The supraclavicular. Okay, and these are the deep cervical. Right there. Okay. Now, as I proceed with this, I'm going to listen to your heart and your lungs sounds. So I'm going to ask you to just remain there, and I'm going to listen to those. Actually, since I was on the neck part, I wanted to also listen to both the temporal arteries. So I'm going to listen with the belt. Very good. And there's no thrill on the left. Okay, very good. And then I want you to look at the left so I can listen to the aorta. Okay, to the right. Very good. Okay. Now I'm going to proceed to listen to the heart sounds through the precordium sounds. And with my diaphragm, I'm going to be on the right second intercostal. And I'm looking for the aortic valve sound. And I'm going to repeat the position again on the left second intercostal. And I'm looking for the pulmonic. Now the next one is going to be Earth's point, and that's on the left third intercostal. Beautiful, nice and strong. Okay. What I want you to do is lift off your left breath and separate it away. Very good. Just like that. A little more. There you go. On the left fifth intercostal, I'm looking for the tricuspid. And one more time. There you go. And for the left fifth intercostal and mid clavicular, I'm looking for the mitral. Wow. Okay, very well. Now, since I already have you in this position, I'm also going to do my long sound. And I'm going to repeat whatever I do on the right, it's going to be also on the left, okay? And I'm going to do everything anteriorly, like on the front first, and then I will proceed to do everything in terms of auscultation, palpation, and percussion from one area and then move to the other area, okay? I want you to take a deep breath for me. Excellent. Slow. Very good. Can you lift up your breath for me? Very good. Oh, excuse me. Okay, can you lift up your breath? Okay. Thank you. Now I'm going to also proceed to assess with tactile remedies. And what I'm going to do is put my fingers on top of your chest and in 6 areas. And I want you to say 99, 99, 99. Okay? Go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Very good. And I'm going to also cast. You don't need to do it. Very good. Now, I'm going to ask you to actually see if you can turn to your right so that way I can repeat the whole assessment of the lung and the posterior area. Okay. I'm going to listen first. Very good. Very good, 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 good cough. Very nice. Very good. Oh, thanks. And again, I'm going to ask you to go ahead and say the words 99, 99,
90, 99, 99, 99, 99, 99.
Excellent. And I'm going to percuss. We can come back to the position. Now, for the next part, I'm going to need you to rest on this pillow, about 30-degree angle. And I will be conducting the measurement of your jugular vein distension. And it should be less than 3, so let's see how you're measuring up. Okay, so you turn, there you go, excellent. And position at the clavicular tip. Yeah. And I'm going to look for the highest point where I can see the right product. Excuse me, the right jugular. And that is a 2. Okay, very good. Since I have you in that position, I'm going to go ahead and inspect and palpate the precordia and for position and for any heaves and for any thrills. Okay, and the way that I'm going to do that is by placing my right hand on your apical area. On the left sternal border, and your base. And I'm going to proceed to actually measure your point of maximum impulse, and that's by measuring in the left external border and listen to the feel the apical area, and also feel your right carotid. Okay. And to make sure that it is synchronized, I want you to turn your head to the left. Very good. And I'm going to feel for your carotid pulse. And it's less than 1 centimeter, which is what we expect. Okay. Now, since I have you in this position, the other thing that I want to conduct is your pulses, peripheral pulses. So I'm going to proceed with the radial. May I see the left one too? Nice and strong, nice and even. And then can you lift up your right knee for me? There you go. And I'm looking for the popliteal pulses. And palpable. And then the left side. There you go. And then I'm going to proceed with the dorsalis pedis. Very good. And with the posterior tibial. Okay, very good. We're going to repeat that on the left side. And again, the posterior tibial. Excellent. Okay. Thank you so much. This concludes the video number 1 for physical assessment. Thank you. And this is Arilma St.Clair.